Alright, let's dive into something that's been making waves in the news lately. Here's the deal. Dr. Erica Schwartz has just been confirmed as the new head of the CDC. Now, on the surface, that might sound like just another bureaucratic appointment, but trust me, there's a lot more going on here. Personally, I think this is a pivotal moment for public health in the U.S., and it raises some serious questions about the future of the agency. First off, let's talk about the context. The CDC has been in turmoil for the past couple of years. Mass resignations, low morale, and a string of controversial decisions have left the agency reeling. What makes this really interesting is that Schwartz is stepping into this role at a time when the CDC is facing some of its biggest challenges in decades. We're talking about a measles resurgence, falling childhood vaccination rates, and a cyclospora outbreak. From my perspective, this isn't just about filling a vacancy. It's about whether the CDC can regain its footing as a trusted public health institution. One thing that immediately stands out is the political backdrop. Schwartz is Trump's third nominee for this position in just 18 months. That's not a great look for stability, right? And it's not just about the turnover. There's been a lot of tension between the CDC and the administration over vaccine policies. What many people don't realize is that this isn't just a scientific debate. It's a battle for the soul of the agency. Will Schwartz be able to steer the CDC back toward evidence-based decision-making, or will she be pressured to toe the political line? That's the million-dollar question. During her confirmation hearing, there was this moment where Senator Bill Cassidy grilled her on whether she'd stand up to the administration if they pushed for policies that contradicted scientific consensus. Initially, he seemed skeptical, but after speaking with her, he changed his tune. Now, I don't know about you, but this gives me mixed feelings. On one hand, it's good that she was able to address his concerns. On the other hand, it makes me wonder, how much independence will she really have? If you take a step back and think about it, this isn't just about Schwartz, it's about the broader issue of political influence in public health. What this really suggests is that the CDC is at a crossroads. The agency has always been a beacon of scientific integrity, but recent events have shaken that reputation. Schwartz has a medical and law degree, and she's got experience as Deputy Surgeon General. That's a solid resume, but let's be real. She's walking into a minefield. The National Public Health Coalition put it perfectly. She needs to prove that her leadership will serve science, not politics. And that's easier said than done, especially when you've got a president who's been openly critical of the CDC's vaccine policies. A detail I find fascinating is the role of Robert F. Kennedy Jr. in all of this. As Health and Human Services Secretary, he's been pushing policies that directly contradict long-standing public health consensus. This has led to frustration among CDC staff, with about 3,000 workers leaving the agency. If you ask me, this is a symptom of a much bigger problem: the politicization of public health. When science takes a backseat to ideology, everyone loses. And that's exactly what's been happening at the CDC. This raises a deeper question. Can the CDC recover from this? I mean, the agency is facing some of its toughest challenges yet, and it's doing so with a depleted workforce and a damaged reputation. Schwartz has her work cut out for her, no doubt. But here's the thing. If she can navigate these challenges and restore the CDC's credibility, it could be a turning point. Personally, I think the stakes couldn't be higher. Public health isn't just about policies and statistics. It's about people's lives. And right now, the CDC needs a leader who's willing to put science first, no matter the political consequences. So what's the takeaway here? In my opinion, Schwartz's confirmation is more than just a personnel change. It's a test of whether the CDC can reclaim its role as a leader in public health. Will she be the steady hand the agency needs? Or will she be another casualty of political turmoil? Only time will tell. But one thing's for sure. The world will be watching. And if you ask me, that's exactly how it should be. Because when it comes to public health, we can't afford to get this wrong.